There is no way to understand the scale of destruction, devastation and desperation that the Israeli siege has caused in Gaza. And with Israel's latest incursion in Rafah, the situation is only worsening. The World Health Organization said on Wednesday that Rafah's hospitals have just 3 days of fuel left. So, joining me today from Gaza to tell us exactly what the dire medical situation looks like right now is Palestinian-American ICU doctor from California, Mohamad Abdel-Fattah. He's currently volunteering at the European hospital in Khan Younis near Rafah's evacuation zone. Dr. Abdel-Fattah, thank you so much for joining me on the show today. You arrived in Rafah on just over a week ago, on May the 1st. Can you tell us what you've seen since you got there? Is it as bad as we're reading it is?
Hello. Yes, it's catastrophic. You know, we arrived about a week ago to the hospital, and as soon as you step foot in the hospital, it's clear it's just chaos. You know, in the corridor, there are families living on both sides of the corridor, separated by just thin sheets. So as you try to maneuver your way through the hospital, there entire families living in every inch. And so you have kids playing in the hospital, you hear babies crying, there's women cooking. Meanwhile, there's sick patients. There's also patients on stretchers being wheeled in and out of the corridors, doctors running by. It's a scene out of an Armageddon, something that you cannot imagine would normally take place in a hospital. I've never seen anything like this. There's no sense of infection control. It's not possible at all to prevent communicable diseases because of the amount of people that are seeking shelter at the hospital. And so it's just striking, and it was very obvious as soon as I got here.
And that is obviously awful to hear, distressing for those of us listening to your account. I can't imagine what you have seen. You call it an Armageddon. Some of us have seen images out of social media, out of Instagram this week, of kids being killed in Rafah, of kids being pulled out of the rubble. What kind of injuries are you seeing from civilians, from families, from children being brought into the European hospital?
Horrific images. Severe burns, total body burns, 50, 60. Today we had an 80% burn on a 7-year-old child yesterday. Severe trauma to the head, gunshot wounds, and just chaos, to be honest. It's hard to even explain. I mean, what I would say is that the hardest thing for me, being a father, to be honest, is seeing the children. And it's not even because I'm a father. I mean, I have colleagues here that don't have children. But it's striking to see how many kids are victim of this war and are being targeted by this war. It's clearly intentional. There is nothing accurate about these ammunitions or these weapons that are being used. I'm seeing my first day here in the ER. There was a 1.5-year-old. Her foot had a large gash, just wide open, and she was screaming. And just next door, there's probably a 4-month-old. His arm was burned and his skin was peeling off. So it's just, you know, the amount of devastation that is occurring to the children of Gaza has been very painful, and it just seems very deliberate. You know, I'm a adult ICU physician. I'm used to treating adults, but here in the ICU, it's mixed. So you'll have an adult patient, and right next to him, you'll have a pediatric patient. And so we're seeing a lot of severe burns that require a lot of detail to treat them, a lot of monitoring, a lot of supplies, a lot of medications, close monitoring, and they just don't have the resources here, unfortunately. They have been through this for 7 months now. They're exhausted, to say the least. The staff is very depleted in supplies. The staff, as you can tell, they're constantly thinking about their families themselves. So it's very hard to practice here as an ICU doctor. The healthcare system is completely destroyed. And it's very intentional. You can tell it's very intentional.
And where you are at the European hospital in Khan Younis, I hate to ask the question, even use the word safe, but is it relatively safe? Do you feel under threat yourself, your own personal safety? Are there Israeli troops positions near you?
So they have told us since the invasion began that our area is in the green zone. Green zone meaning that we are safe. You know, the Israelis did drop leaflets earlier prior to the invasion showing areas that are red zones. There was just a strike. And areas that are green zones. So we are on the edge of the red and the green. And so our team has told us consistently, daily, that we're still safe here. And to be honest with you, when you're in the hospital, you do feel safe. I mean, for me, I was kind of disconnected from what's happening outside. We're just seeing patients, patient to patient. So it's hard to know what's happening outside. All we see is sort of what's coming in. And so, and we hear, obviously, we hear what's happening around us. There's bombings, there's constant drones. We saw flares in the skies a couple of nights ago, which told us that there were some ground troops close by. But yeah, I mean, to be honest with you, in the hospital, I do feel safe. But at the same time, I know what's happened to hospitals in Gaza, and the massacres that have happened in Gaza. And all of the staff know, too. A lot of them are displaced from previous hospitals. I'm working with previous doctors who are at Shifa Hospital. I'm working with nurses who are at Nasser Hospital. So they've been displaced multiple times, and they have said themselves, this is what it tends to look like when it gets close to them coming into the area. You know, it's hard for staff and nurses to actually come to the hospital because it's a dangerous trek to the hospital.
Yes.
So there's a severe shortage in doctors as well.
One last question to you, Dr. Abdel-Fattah. You are an American citizen out of California. What is your message to the President of the United States today? And what did you make of Joe Biden's decision earlier this week to suspend one shipment of arms to the Israelis?
My message to the president is that for me, as an American, I've had hope for 6-7 months that, you know, he would end this. But my message is that I see him for who he is now. He is okay with the killing. He's okay with the children being massacred every night. And it's clear. And come November, we will remember. We're not going to forget. And Joe Biden will be a one-term president. And this is intentional. He's okay with this, and this is unacceptable for any human being to go through this amount of suffering.
Dr. Abdel-Fattah, we thank you for your time. We appreciate what you're doing out there. Please do stay safe, and thank you for joining us today.
Thank you so much, Mehdi.